How can I lose weight before orthopedic surgery? That's a common question and a common desire before having surgery is to trim down a little bit. My name is Dr. Dan Albright. I'm an orthopedic surgeon in Raleigh, North Carolina. And I see a lot of patients, normal weight, underweight, and overweight. And losing weight before surgery can really help you do better at surgery. So the first way is get in the pool, indoor pool. It's got to be an indoor pool because if you wait for outdoor, it's going to rain or it's not going to be sunny or warm enough for something. So indoor pool. I have a lot of patients with arthritis, crippling pain at the hip, knee, back. And getting in a pool takes weight off your joints and you can move. You can actually get a good muscle workout. And I promise you get in the pool, you will sleep better, think better, you'll feel better, you'll trim down, your muscle tone will get better. You'll be a safer patient for surgery. So it's really important, get in the pool. You know, if not that, then a stationary bike, but not everybody can do a stationary bike. The pool is the place. You got to walk in the pool, you got to dance in the pool, run in the pool, swim in the pool, anything in the pool, water aerobics, pool therapy, do pool therapy all the time. That's part one. Part two is what you put in your mouth. And that's a big part of nutrition and health. And I am anti-gluten. We were raised throughout our whole lives as children and all, healthy whole grains. And the government and everyone is saying that. Well, grains are not healthy. And there's a lot of science coming out in the last several years. Grains are not healthy. So losing weight, I invite you, please go 1 month gluten-free. You've heard of gluten. Gluten is a reactive protein in wheat and bread and pasta. Go gluten-free for 1 month and you'll be amazed. One, you'll feel better, you'll think better, you'll lose 20 pounds without even trying, and you'll be safer for surgery. So that means no bread, no pasta, no wheat. Read the label. If it's processed food, almost always it has wheat in it. You got to eat whole food. You got to eat good food, good calories, healthy calories. That's the main thing, is gluten-free. And I'll just tell you, gluten goes to your brain. It occupies the morphine receptors in your brain and makes it to bread and pizza. At least I was when I was doing it. And it also gives you a sugar rush, which is a problem. And it's inflammatory. Gluten actually inflames tissues. It makes you swollen and puffy and bloated in at least 1 out of 3 Americans. So there's several reasons to stop gluten. And that's my main message here for weight loss. The other part is just sugar and carbohydrates. Pure sugar it's not good. It shoots up your insulin. Insulin's called the fat hormone. So if you want to get fat, you get the fat hormone going, which is a lot of insulin. So the only way to get your insulin down is to go less sugar, less carbohydrates. Again, a lot of science exists for this and a lot of good books on this topic. So I have an interest in doing safe surgery and I want my patients trimmed down some. And so losing weight before surgery is good. This is how. Get in the pool, tone up, go gluten-free for a month, and think about less sugar. And that'll do it. I've got many patients who've done it, and they've been very thankful for that. I'm happy to talk to you more about that, about how to make you a safer person to undergo a surgery procedure. I'm Dr. Dan Albright. Website is danalbrightmd.com. Appointment line 919-863-6808. Thanks.